Welcome. Welcome to our 2001 Annual General Meeting. Thank you so much for making the time to join us from the comfort of your home, your office, or your home office. We are absolutely thrilled this web event can reach people across the entire province and not just those in the Lower Mainland. My name is Phaedra Aldridge, and I'm the CEO of the BC Schizophrenia Society, otherwise known as BCSS, and it is an absolute pleasure to be with you today, although I do wish it was in person. I would like to start by acknowledging that we are grateful to be virtually gathered on Indigenous land, regardless of where you're joining from. From our offices in Vancouver, I'm grateful to be on the traditional, ancestral, and unceded territory of the Coast Salish peoples, including the territories of the Musqueam, Tsleil-Waututh, and Squamish nations. Today, we're going to begin our AGM, where we will be recognizing Dr. Mahesh Menon with the BCSS Champion Award. And starting immediately after our AGM, we will be welcoming Minister Sheila Malcolmson to say a few words. Caitlin Lemiski, who is a Director of Policy from the Office of Privacy and Information Sharing Commissioner of BC, will then be helping us better understand confidentiality and what resources are available to help bridge the gap and help healthcare professionals and family members build a better circle of care. So let's begin. It is my pleasure to introduce you to David Halakowski, who is the president of the BCSS, who will be leading the annual general meeting today.
Thank you very much for joining us at our AGM. To start, I just want to remind you about the process for the virtual AGM. All BCSS members who are members in good standing by Friday, September 24th, should have received a link to our voting platform, Slido. If you didn't receive a link, please email Cynthia and Andrew at the email address provided in the chat. Slido is where the voting will take place. During the meeting, I will read out the motion and ask for someone to move the motion in the chat. If you would like to move a motion, type your full name in the chat box that you are moving the motion. Remember to make sure you are messaging everyone and not just one of the staff people. For example, I, David Halakowski, move this motion. Phaedra will then read aloud the name of the member who is making the motion. I will then be asking who will second the motion. And the same thing, you type in I, David Halakowski, second the motion, and then Phaedra will read out your name. Please use your full name. It just makes it smoother and easier to accurately capture this information for our minutes if you use your full name. Voting during the AGM is simple. It does not require you to install any software or to sign up for anything. Simply click on the link we've provided to our members via email prior to the event from your computer or mobile device. It will then send you the motion and ask you to vote. Simply click yes, no, or abstain to each question and click send. That's it. The poll will then advance automatically as the voting comes in. If you are a member in good standing but did not receive any link to vote, please email Cynthia and Andrew directly. Today, excuse me. Today's event is made possible with funding from Janssen and Bill Let's Talk. Thank you for your support. So are we ready? It is 1:15, and I now call to order the British Columbia Schizophrenia Society 2020-21 Annual General Meeting. So the first order of business is the agenda. Who would like to make the motion to adopt the agenda for the 2020-21 BCSS AGM as presented? Phaedra, who is making the motion?
Thanks, Dave. We're just gathering it here. Don Mansour moves the motion, Dave.
Thank you. Who is seconding the motion?
We're gathering that. Dave, Susan Inman seconds the motion.
Thank you. So now you can vote for this motion that will appear on your screen. So have we had enough time for people to vote?
Yep. Yes, we have. We can move on to the next one, Dave.
Oh, okay, so then
Oh,
there's 11 people.
no, sorry, Dave.
Huh?
My bad. We're still waiting.
Okay, sorry.
The joys of virtual meetings. Okay.
Are we good to announce?
Not yet. Still waiting. So please, everybody, if you haven't voted yet and you are able to vote, please remember to vote in Slido. We need your votes. Still waiting, Dave. I feel like we're in Jeopardy.
Yeah. Is this Jeopardy?
So please remember to vote in Slido. We're still waiting. So there's 22 members that are on right now. Please, if you are a member, we really do need you to vote because this is an official AGM. Looks like we're dealing with some technical issues here and working out some kinks. We still don't have quorum yet, so unfortunately, we still have to wait. And this Slido is in the email that was sent to you earlier in your email. And yes, you just have to click on yes, no, or abstain when you see the poll.
So I see.
And remember to hit send. So yes, no, or abstain. And please remember to hit send. You do have to hit send after you hit one of those three choices.
So Phaedra, I see that we have more than 50% of the voting members that have voted already in favor. So I think I will declare this motion carried.
Okay, there's, okay, then we're good to go. Okay,
Okay.
thank you, Dave.
So the next item then on the agenda is the approval of the minutes from the 2019-20 BCSS AGM. The minutes from September 23rd, 2020. If you have any corrections to the minutes, please submit them in the chat box and Phaedra will read them out. Let's wait a moment to see if there are anything that comes up.
Thank you, Dave. So yes, absolutely. Any corrections to the minute, please put in the chat box so we can make it official. I'm not seeing anything yet, Dave.
I'm waiting for the drum roll.
Yes, exactly. Official drum roll. Okay, Dave, I'm not, doesn't look like we have
Okay.
any corrections.
So seeing that there's no corrections, who would like to make the motion to approve the minutes from 2019-20 AGM?
Dave Jack Middleton moves the
Thank you.
motion.
Rita, who's seconding the motion?
Lisa Kofod seconds a motion.
Thank you. So now we will vote, please, in Slido. So yes, no, or abstain.
So once again, please vote in Slido, the motion to approve the BCSS minutes from last year, so 2019-2020, from Saturday, September 23rd, 2020, as presented. Yes, abstain, or no, and please remember to hit send.
So I have more than enough votes for a majority of the voting members. I'll wait for another few seconds, and if there are no more votes coming in, there's 21 votes for yes, so I declare the motion carried. So next item on the agenda then is our next is the financial statements for the year ending March 31st, 2021. So I'd like to turn the floor over to our auditor, Eric Elias from Tompkins Wozni Chartered Accountants, to present the audited financial statements. Thank you for joining us today, Eric.
My pleasure. Hello, everyone. My name is Eric Alice with Tompkins Wozni. We were your auditors for your March 31st, 2021 financial statements, and I'm happy to present those to you. And I'm just going to share my screen to show those. Hopefully everyone can see that. Here we have the March 31st, 2021 financial statements for the Society. Our job as auditors is to present an assessment on the financial statements and provide an opinion, which we do here on pages 1 and 2 with our independent auditors report. It goes into some detail of everyone's responsibilities. And I'll just highlight our responsibilities as auditors. The starting point is identifying and assessing the risks of material misstatements in the financial statements, whether due to fraud or error. So what we're doing there is making sure that all the grant contracts, all the revenue contracts are complete and reported in these financial statements. The revenue recognition is proper over the fiscal year end. This year you had some COVID funding as well. So taking a look at those, making sure all the donation revenue is complete. The disbursements are primarily in payroll, so verifying that those are supported and authorized expenses. You're also a registered charity, so taking a look at compliance with CRA regulations, looking at the balance sheet, the cash balances, and just the overall financial statement presentation, making sure this is a transparent story for your March 31st, 2021 fiscal year end. And I'm happy to report when we audited those areas, it all came back clean. So this is an unqualified report where we are stating as independent auditors that we feel that these financial statements do present fairly for your March 31st, 2021 fiscal year end in accordance with Canadian accounting standards for not-for-profit organizations. So for a charity that's accepting of donations, this is a clean opinion on your March 31st, 2021 financial statements. So a big thank you to Phaedra and the management team and all the management that helps during the audit process, and Joanne and the board of directors for doing diligent work on their financial statements and having good oversight over the financial reporting process. Very happy to present that clean opinion. I'll just briefly highlight the financial figures for the 2021 fiscal year end. First, there is a balance sheet, a statement of financial position as at March 31st with comparison to last year. And there it shows the Society had at March 31st, 1,362,827 of total assets. On the other side of the balance sheet, the obligations were $777,438. And when we take the assets less the liabilities, we get the total net assets or equity of $585,389. That's the net number on this page. This is the net amount that we're carrying forward into 2022 as a retained earnings to provide our services in the next year. Compared to last year, that number was 219,000. It has increased by 366,000. And just jumping ahead for one moment, the bottom line surplus this year was $366,000. And it increased the equity, the fund balances from 219,000 to 585,000. That will carry forward into 2022. And other than that, there has been a decrease. The society does receive multi-year grants, so those have been drawn down over the last fiscal year, and the related cash balances have also been drawn down, and that is the change compared to the prior year. But overall, an increasing financial position, very liquid with cash and investments, and 585,000 being carried forward to 2022. And we can see how we did that by looking at the revenues and expenses on the statement of operations with comparison to last year. This is the revenues and expenses for the fiscal year end for the 12 months ended. And here we find there was revenues of $2,382,877, and the disbursements and expenses were $2,016,620. So there is that surplus of 366 that is being carried forward into next year in the net assets. And just with comparison to last year, the program funding did decrease. There are several funding revenue contracts that we have, and it came in at 1.68 million. Donations did drop a little bit. Program funding did drop a little bit, but what made up the difference, we had some COVID funding, and it's in other income, and that really offset some of the other decreases. So our revenues for the year actually were almost identical to last year at 2,382,000. And on the disbursement side, 75% of the disbursements are in investments in your people, in human resources, under the wages and contractors and benefits category. So out of your 2 million, 1.5 million or 75% is concentrated in human resources. And then you have the rest of the operating expenses, some variations because of COVID, less travel and so on. And at the end of the year, there was a net income of 366,257. So that's a quick highlight of the revenues, expenses, assets, and liabilities and our clean auditors report. And that concludes my presentation. If there's, I don't know if there's opportunity for questions, but thank you.
Thank you, Eric. And I'm sure that the membership, as well as the board of directors and the rest of society, are always glad to hear that we have a clean report. So thank you for those comments, and just sort of chit chatting to see if there are any questions of you. I don't see any on my screen, so that concludes the report. So we'll move into the motion part. So I need a motion then to approve the 2020-21 audited financial statements for the year ending March 31st, 2021. Is there a mover for that motion?
Renato Zane moves it, Dave.
Thank you. Is there a seconder?
Colleen Crosley
Thank you.
seconds the motion.
So now we'll move to the voting part. And so please, on your Slido, vote yes, no, or abstain.
We have it down pat now. Yes, so
We're getting
yes
there.
or no, and please remember to hit submit on Slido. And we're just gathering the results now.
By the time we get to the last motion, we'll be perfect.
No problem. Yeah.
So
right, we are good to go. Dave?
We have more than a majority of the voting members voting yes, so I declare the motion carried. So the appointment of the auditor for next year. I'd like a motion, please, is to appoint Tompkins Wozni LLP as the auditor for our 2021-22 fiscal year. So is there a mover for that motion, please?
Yes, Lisa Kofod moves the motion. Dave?
Thank you, Lisa. Is there a seconder?
And Renato Zane seconds the motion to
Thank
appoint.
you, Renato. So now we'll vote on that motion. So either vote yes, no, or abstain.
Everyone's so quick. Thank you for that. Look at that speed. It's fantastic. So there again, so please hit yes, no, abstain in Slido.
So we have way more than the majority of voting members, so I declare this motion carried as well. So the annual report. I just want to take a moment to thank our many members, volunteers, staff, donors, and sponsors for their support for BC Schizophrenia Society. Because of you, families affected by schizophrenia and other serious mental illnesses continue to receive education and support. You let your community leaders, government officials, and us know that BCSS has made a difference in your life and in the lives of your loved ones. And your active engagement and dedication have helped us to reach and connect with the hundreds of new families over the past year, while continuing to provide support and programs online, over the phone, and in person when possible. Thank you so very much. And thanks to the generosity of the provincial government, donors and corporate sponsors, stakeholders and volunteers who have been able to sustain and adapt our programs and services to help people throughout BC. So what we have done in the past year, let's take a quick look.
Schizophrenia can be a devastating and serious illness, and for the 1 in 100 people affected worldwide, it can feel like they are lost, alone, and without hope. Support and compassion from family members and caregivers can lead to early diagnosis, proper treatment, and significantly improve the lives of loved ones coping with this mental illness. Since 1982, the British Columbia Schizophrenia Society has been supporting thousands of individuals and families affected by schizophrenia and psychosis throughout our province. Whether a family is just beginning to suspect that something is not right or has been maintaining proper treatment for years, the British Columbia Schizophrenia Society connects with family and community members who are looking for help and assistance, online and in person. Programs and services are at the heart of our organization. Across the province, our regional educators provide direct one-on-one support, while monthly family support groups provide the opportunity to share stories of triumphs and struggles. Multi-week educational courses teach families how to better communicate and build relationships, not only within the family, but also with healthcare and emergency professionals. Our Kids and Teens in Control programs provide resources to help children and youth build compassion and connections with family members who live with mental illness. And our Partnership Education Presentation program continues to bring together citizens, corporations, government and community agencies, allowing the British Columbia Schizophrenia Society to challenge the stigma of mental illness through education, support, public policy, and research. All of these programs and services are supported by our generous volunteers who are advocates for families and crucial in the continued success of our organization. Each year, the British Columbia Schizophrenia Society is able to provide thousands of hours directly supporting families, allowing our programs to expand across the province, from urban centers to rural and northern communities throughout BC. Together, with the continued support of the provincial government, donors, partners, sponsors, staff, and volunteers, we are providing families across British Columbia a reason to hope and the means to cope.
In addition to all other highlights of the past, this year include the funding from the BC Ministry of Mental Health and Addictions. Our kids and teens in our kids and teens in control programs created the Caring for You video series for children. A series of videos highlighting self-care strategies that were especially important in helping children cope last year during the start of the global pandemic. BCSS, with support from BC Partners in Mental Health and Substance Use, launched Look Again, Mental Illness Reexamined, a podcast helping people reframe their understanding of schizophrenia and the stigma surrounding sorry, folks.
Dave, do you want me to jump in here while you find your spot?
Yeah, we're there
Okay.
now.
Yeah.
The BCSS.
So the podcast helping people reframe their understanding of schizophrenia and the stigma surrounding serious mental illness. And currently, there's been more than 5,000 listens to this podcast.
Thank you. The BCSS staff have also done an amazing job learning new skills, adjusting to its programs so that we could continue to offer family support groups and strengthening families together virtually to families across BC. And in case you missed it in the video, last year alone, BCSS regional educators connected with 851 new families to provide them with information and support. This is approximately 40% more new families compared to the previous year. And before I finish, I also want to take a moment to commend the families that BCSS supports and recognize the determination, fortitude, and the resilience that they have shown in the face of schizophrenia and serious mental illness. You inspire us all. Sorry for the sort of interruption, folks, but so the approval of the board of directors for the coming year is now the BCSS board of directors for 2021-22. The slate for this upcoming year's board is David Helikowski, Dr. John Gray, Joanne Leung, Fred Daw, Lena Bortnick, Susan Inman, Don Monzur, Donna Motzer, Jack Middleton, Dr. Fidel Villa Rodriguez, Paul Busan, and Colleen Crosley. Sorry, Colleen. Who's making the motion now to approve the 2021-22 board of directors, Phaedra?
Okay, we'll gather that. And Lisa Kofod moves this motion, Dave.
Thank you, Lisa. Seconder?
Renato Zane seconds a motion.
Thank you, Renata. We'll now vote. So on your Slido, please yes, no, or abstain.
Still gathering, Dave. So once again, motion to approve the slate for BCSS Board of Directors. for this year to be approved as Dave presented? Yes, abstain, or no, and please remember to hit send.
So
And I think we
We
are good to
have
go,
a-
Dave.
good. We have a majority of members that can vote, voting yes. So thank you so much. I'd like to present now your new board of directors for the coming year. Please stand up, board, so you can. Normally I do that at a meeting that we went to. So you can have a look at everybody and their smiling faces. And also just, it's not in the script, but I'd like to just take the opportunity at the moment to thank the board of directors that have supported me and Phaedra in the past year. And I know that you'll continue to do the excellent job that you do, continuing to support the great work that everybody puts so much effort into. Thank you so much. So now I am going to turn the floor over to Phaedra Aldrich, BCSS Chief Operating Officer, for a few words. Thank you, Phaedra.
Thanks, Dave. And yes, Dave, I do look forward to the day when we can have in-person meetings again. I really do. Okay, so I'm so happy that you are here today to join us, whether you're joining us from the island, from Prince George or Kamloops. Thank you for being here. For those of you that don't know me yet, my name is Phaedra Aldridge, and I am the CEO of the BC Schizophrenia Society. And I would like to start by acknowledging that we are grateful to be virtually gathered on Indigenous land. I am grateful to be on the traditional, ancestral, and unceded territory of the Coast Salish peoples, including the territories of the Musqueam, Tsleil-Waututh, and Squamish nations. Now, before I get into my summary of the previous year, I would be remiss if I did not start off by saying thank you to my awesome team, to the regional managers, the educators, and the entire provincial office team. Thank you. I've said this over and over again, and it truly takes an entire team to make an organization a success. And I am so honored to be a part of this team. Your competence, your dedication, and your loyalty to our families shone brightly this year. And it was a tough year. So thank you. We made it through funding challenges, program changes, and an increase, as we said earlier, of close to 40% in calls from new families who needed our support last year during the global pandemic. We couldn't have done it without you, team. So thank you. And for today's event, Jean, wow, thank you for all your help in organizing this event. We couldn't have done it without you. You kept us all on track. Andrew, Cynthia, Sunita, thank you for all your help in preparing for the AGM for this event and every day this year. Thank you. To our boards, two boards, the Society and the Foundation, volunteer board members, our volunteer policy committee, thank you for volunteering your valuable time to help us move BCSS forward. I so enjoy both the team, the boards, and the policy committee, and I'm just so honored I get to work every day with you. And a big thank you to the financial support that we received this year. As we said, it was not easy, and I am so very grateful for the long-standing partnerships that we have created with the provincial government, so the Ministry of Mental Health and Addictions, as well as with the Ministry of Health, to all of our donors and our sponsors of this event, Janssen and Bell Let's Talk. Through our donors and our sponsorships, events like today can remain free to the public, and we can ensure that donations made to BCSS will go towards the programs and the services for families impacted by schizophrenia and serious mental illness. Schizophrenia, as most of you know, is a very serious mental illness that still has a lot of unanswered questions and is greatly surrounded by stigma. It is not a rare illness, and that's one of the things that I want to talk about as much as I possibly can. 1 out of 100 people have schizophrenia, and 3 out of 100 people experience psychosis. One of the goals this year was to increase awareness about serious mental illness. Let's shout it from the rooftops. We need to. It's health, it's economic, it's social implications, and more than anything, the impacts on the individual with the illness as well as the family. And due to this pandemic, there was a lot of public education around depression and anxiety, which is essential. It's very important. But we cannot forget about serious mental illness like schizophrenia, what it is, the myths, the many effects that it has on the person living with it and the people that care for that person. Not to mention the financial implications on our very precious and our limited healthcare dollars. BCSS in this past year has done a lot to increase awareness of serious mental health and serious mental illness through a number of ways: more staff in rural and underserved areas of our province, more staff to support our younger generation through our kids and teens in control programs, the creation of a number of videos, including a real and emotional video looking at schizophrenia through the eyes of people living with the illness, as well as their family members, a video looking at the connection between cannabis and serious mental illness, plus other videos. We've also created a podcast that has turned out to be quite successful called Look Again, Mental Illness Reexamined. So if you haven't listened to it, check it out. You can listen to it anywhere where you do listen, Apple, Spotify, wherever else you get your podcasts. We've also created a virtual family support groups. We have started to revise our programs, including our Strengthening Families Together program. And this revised program is being created by experts and vetted by a number of people, including our medical experts on our medical advisory board. This year, we also formally changed the organization's mission and our vision to acknowledge the crucial and essential role that families play. BCSS's new mission is now to support families affected by schizophrenia and other serious mental illnesses in British Columbia through education, advocacy, and research. We have also worked hard to strengthen our partnerships within the community, the ministries, health authorities, and other community partners. In order for there to be change, we have got to work together. It's essential. We have come a long way, but we still have a long way to go with educating people, supporting those dealing with the illness, and helping to create change throughout our entire province. As I said earlier, we cannot do this alone. So thank you so much for being a part of this exciting time and making change happen. Thank you for being here. Thank you for being a part of our organization. Thank you for speaking up. And Dave, over to you. Thank you.
Thank you, Phaedra. So now we go to other business on our agenda. And now I would like to introduce Susan Inman. Susan is a very active BCSS board member and has the honor of presenting this year's BCSS Champion Award. Susan.
I am okay. It looks like the host needs to start my video. Yay. Thank you. I am thrilled to be able to present this year's BCSS Champion Award to Dr. Mahesh Menon. Before I tell you exactly why Dr. Menon is deserving of this award, let me tell you a bit more about who he is. Dr. Menon grew up in India and received his bachelor's and PhD in psychology at the University of Cambridge in the UK. He then did a research and clinical fellowship at Toronto Centre for Addiction and Mental Health. He continued on as a faculty member at the University of Toronto before he started his current position at UBC Hospital. This position includes working at the BC Psychosis Program. Dr. Menon is a registered psychologist and clinical associate professor in the Department of Psychiatry at UBC. His research focuses on understanding the cognitive mechanisms and brain networks associated with the symptoms of psychosis, and on understanding the role of psychotherapy in improving these symptoms. Recently, he was a recipient of the 2021 Innovation and Translational Research Award from the Vancouver Coastal Health Research Institute. This award is for his work on addressing persistent auditory hallucinations with virtual reality-based avatar therapy. Today, we are honoring Dr. Menon for his extraordinary contributions in promoting cognitive remediation therapy. This is the therapy that helps the many people with schizophrenia whose illnesses have created significant cognitive losses. Cognitive losses are the biggest factor in the widespread disability of this population. I know that many of you attended the sold-out 2017 conference that the BCSS initiated on bringing cognitive remediation to British Columbia. To create this conference, the BCSS collaborated with the BC Psychosis Program, BC Early Psychosis Intervention, and BC Psychosocial Rehabilitation. Representatives from these 4 organizations continue to meet over the next 2 years. The group created various plans for implementing cognitive remediation, but efforts were not moving forward. Now comes the part of the story that shows us what makes a champion. Dr. Menon decided to move things forward himself. Last year, he worked to organize a remote training program for clinicians. The training was led by Dr. Christopher Bowie, who is a Canadian and international expert in cognitive remediation. Many clinicians have been waiting and wanting to better understand the cognitive deficits they are seeing and clearly want to be able to help their clients. Even though clinicians had to finance this training themselves, over 50 clinicians representing all of BC's health authorities arranged to participate in this training. They are now in the process, under the guidance of Dr. Menon, of trying to implement programs across the province. Perhaps many of you can help let service providers know that cognitive remediation is very much needed. Today, the BCSS is recognizing you, Dr. Menon, with its Champion Award. It's given to people who have played an essential role in promoting its vision of a province where those living with schizophrenia receive excellent treatment and services. I hope people will join me in remotely applauding Dr. Menon for his extraordinary contribution. Thank you, Dr. Menon. We will now return to David Halakowski.
Thank you, Susan, and congratulations, Dr. Menon.
Thank you so much for this honor. I'm truly grateful and humbled. I really want to thank the BC Schizophrenia Society, not just for this award, but for such a long time. I first came to Vancouver in 2003 and support from the Norma Calder Foundation, which then became the BC Schizophrenia Society. And I returned in 2012. Some of the early work that we were just starting off at that point on CRT supported through the Mind Foundation as well. Subsequently, as mentioned, we had started to put together a CRT BC CRT working group. And I particularly want to thank Dr. Tom Eamon, Gray, Dr. Regina Casey, Dr. John Higginbottom, Dr. Gary Vandelier, champions in the different health authorities who've been the ones who've been really pushing to make sure that CRT becomes accessible across the province itself. And the workshop also would have been impossible without the support of Canada, and especially Vicky Yoon and Susan Boyce. That I work in an organization and a clinical program that similarly believes in a holistic view of recovery, has really prioritized integrating a range of different psychosocial approaches for psychosis therapy and CRT. And that has continued to support us expanding not just to our program, but to clinical programs across BC. So the BC Schizophrenia, has been so great, and my own organization, the BC, which has just been an incredible place to work. And I really want to thank my colleagues there, particularly Dr. Randall Watt with the BCSS, Dr. Bill Honer, Dr. Ivan Torres, and Carol Radko, who've all allowed me to do some of this work in expanding CRT out as well. And intervention like CRT is really grounded in a lot of background research. So the work that Chris Bowie has been doing, research program has been done in conjunction with my friend and long-term collaborator, Dr. Todd Wood, my friend Stefan Moritz in Hamburg. And it's wonderful to be able to work with who also happen to be just so brilliant. And there's a list of other brilliant and wonderful, of course, that includes my parents, my brother, and especially my partner, Dr. Trina Blake, who's for all of my wacky ideas. I first, when I started volunteering in 1995 with an organization called the Banyan, which is an NGO in India that works with mentally ill, destitute women. And they've continued doing inspiring work. So I'd just like to dedicate this award to the Banyan and all of the patients and clients that I've had the privilege of working with over the years who've trusted me and the recovery journey with me. And for those of you who are interested in just hearing more about stuff, I'll be giving a longer talk and really nerding out at the members only event on October. I'll leave the details of it to that point. In the meantime, I just want to thank all of you again. Thank you so much, privilege.
Thank you, Dr. Menon. You're welcome and you're most appreciative. So if you want to learn more about the work that Dr. Menon is doing in the area of cognitive loss and cognitive remediation, we have a special members only event at the end of October where you can ask him your questions. It is for BCSS members only, but it's not too late to become a BCSS member. And you can find a link to become a BCS member in the chat box. So membership fees are $15 annually. Together we can build a future free of stigma and a province that provides excellent treatment and service for people affected by schizophrenia and psychosis. So the next point then is the meeting motion or the meeting to adjourn. So, but before we do that, I would just like to put out my thanks to the board who are so helpful in doing the things that we do. I also have to just congratulate and honor Phaedra Aldridge, who has helped to bring our organization forward in the province to points that I don't think we've been to before, and all the staff that are behind her that make that whole team work so well. So thank you all. So now I would like to look for a motion to adjourn the meeting. Is there a motion from the floor to do that?
Thank you for your comments, Dave. And you're absolutely right. It does take a team. Thank you for your comments. And thank you for everything you've done, Dave, this year. And yes, to answer your question, Dave Mansour moves the motion.
Thank you. We really don't need a seconder for an adjournment motion,
Bob Kenward.
but we'll
you
take
do.
one anyhow.
Yeah.
So vote on your Slido. I think that everybody probably wouldn't vote not to adjourn. So thank you all the people that are out there. And I know you're looking forward to the next portion of our meeting. Some words from the minister. Thank you very much to the minister for joining us today. And then thank you to our guest speaker, who I know you'll all enjoy and we'll all have some questions for. So the motion has passed to adjourn. So I adjourn this meeting, this AGM of BCSS for this year. Thank you so much, everybody. And drive safely home or whatever you're doing, which is what I normally say at the end of a virtual or a real meeting. So goodbye, everybody.
Okay, no, we're not done yet.
I know,
So thank you, Dave.
but
And yes,
you're done with
habit.
my picture, so I'm gone.
Okay, thanks, Dave. And yes, thank you for joining us for the AGM, but the day is definitely not over. So please stay on. We have an amazing presentation and a very special guest coming up. Our presentation today is called Come Together, Understanding Privacy and Information Sharing Legislation in Relation to the Mental Health System. But first, we're going to take a very quick break and get back for the second part of this event. Okay, the second part of our meeting. Welcome to the BC Schizophrenia Society AGM Education Session called Come Together, Understanding Privacy and Information Sharing Legislation in Relation to the Mental Health System. This is a huge issue and one we hear a lot about. So it's time we discuss this and had a public event about this issue. There are so many unanswered questions around legislation and the rights of family members. Today, we want to get answers to some of these questions. We're going to share stories from families. We are going to hear from one family member tell her story, all to help paint a picture about what many families go through and the challenges they face, unfortunately, sometimes on a daily basis. With the help of the nurses and the nurse practitioners of BC, we're going to share a scenario from a frontline healthcare professional from Northern British Columbia, detailing one of the most common issues that nurses face across the province. But before we begin, I get the honor of introducing a very special guest, the BC Minister of Mental Health and Addictions, Minister Sheila Malcolmson. Minister Malcolmson is new to the ministry, but has already demonstrated her true commitment to make significant changes and support families through our province. I know that many people and organizations, including ours, have benefited from this. Minister Malcolmson, thank you so much for taking the time to join us today.
Phaedra, thank you so much for the very generous welcome and the invitation. I am grateful to be with you on Snuneymuxw First Nations territory today, from the community that I represent in Nanaimo. Greetings to you, Phaedra. Hello also to Caitlin Lemiski, from the Office of Privacy and Information Commission. This is going to be a very important conversation ahead. And hello to the families and everybody that's working at BC Schizophrenia Society, doing such important work to bridge families, to bridge families to the resources that you need to keep connected to your communities and to supports that are there. This work that you're doing is such a vital part of the work that our government is doing to build that comprehensive system of mental health and addictions care that works for everyone in British Columbia. One that we don't yet have, but we are working in that direction. More than 50,000 people across British Columbia live with schizophrenia, and I recognize the impacts that has on people's education, on work, on social life. And I know how much of a toll those challenges take on the well-being of families who often feel frustration and grief and sometimes shame. It must be so difficult to see a loved one struggling. And I know and I hear daily how vital it is when families are there to help connect people to the care that they need, that's a vital part of improving quality of life, a vital part of that path to wellness. Finding the right treatment to help build that rich and satisfying and meaningful life, helping managing symptoms for better outcomes. And this has chronic stress of the weight of this responsibility, I know takes a toll on families. So, in everything that we hear and that we see, we know that families and caregivers need support also. And we're so grateful to the BC Schizophrenia Society for taking on that really important role. I hear how family members gain healthy coping strategies, how they learn to better understand mental illness, and how they get better connected to that supportive community that BCSS represents. We as a provincial government recognize the value of this work. We're grateful for the service that you are bringing to people across British Columbia, and we have recognized that in part with our $1 million funding commitment this year, specifically to support families of those living with serious mental illness. Also, the work that you've done, in part led directly to our significant budget commitment that the finance minister announced in April of this year, $53 million for early psychosis intervention, because we've heard from people on the ground how important it is to connect people to treatment early and try to get at problems while they're still smaller before they grow into big ones. I look forward to continuing to work with and for and side by side with the society. I am also looking forward very much to hearing your guest today. We recognize that the family members who turn to BC Schizophrenia Society are there looking for answers and care and compassion. And this education session that you've set up today is a perfect illustration of that. I hear this in my own constituency office in Nanaimo, how navigating the system can be very challenging for people at an already stressful time. And so thank you for connecting families to this information that's going to help navigate the system better. We know how much families want to have information about their loved ones, about their condition, about their treatment options. I've heard directly how family members and caregivers said that they were surprised to hear that doctors and other service providers cannot share information about their family members' health. I recognize how frustrating that is for everyone, and that it can limit the support that family members are able to give to their loved ones. And so this session on privacy and information sharing legislation in relation to the mental health care system is so important. I'm really pleased to introduce Caitlin Lemiski, who's the Director of Policy from the BC Office of Privacy and Information Commission. She's going to help alleviate some of the challenges that arise for families. And I expect that coming out of this session with a better understanding of how we can better knit together people and connect people, navigate the system and connect people to care, that we will be able to expand on our collaboration, supporting people with serious mental illness on their recovery journey. Thank you so much to the families, the caregivers, everybody working at BC Schizophrenia Society. Thank you to Caitlin Lemiski for this work, and I look forward to the session. Thank you.
Thank you. Thank you, Minister Malcolmson. I could feel your compassion and your dedication through the screen, and I've just so enjoyed working with you and your team on behalf of all of BCSS. Thank you for your kind words. We truly applaud the provincial government's continued efforts to recognize and support serious mental illness and the need to support our families across this province. We need the support more than ever, so thank you. I'd also like to thank our sponsors again today, Janssen and Bell Let's Talk, for making today's event possible. And as Minister Malcolmson said, this afternoon, we have another very special guest, Caitlin Lemiski, who is the Director of Policy from the Office of Information and Privacy Commissioner of BC, who will be joining us today. So here's a little bit about Caitlin. Caitlin grew up in the Lower Mainland and now calls Victoria home. She has an arts degree from UVic, a law degree from the University of Manitoba. She joined the OIPC, thank goodness there's an acronym for that, Caitlin, in 2006, and has spent several years helping individuals, organizations, and public agencies navigate BC's privacy laws. She's also conducted investigations, written reports, and adjudicated access to information disputes. And when she's not working, Caitlin enjoys playing with her children and gardening. Caitlin, Thank you so much for being here today.
Phaedra, thank you so much for that kind introduction. Minister Malcolmson, thank you so much for that kind introduction as well. It is my privilege to be with you here today. Thank you so much for inviting our office to speak, and I am very humbled to get to represent the office today. I am coming to you from unceded Coast Salish territory of the Algonquin-speaking peoples, the Songhees First Nations, and the Esquimalt First Nations. So for the next 30 minutes, no more, I'm going to go through a deck to try to provide some practical information, some level setting about some of the privacy and access laws in this province, things that will be, I think, the most helpful for this group to understand in terms of the challenges they may face. And then I want to leave lots of time for a moderated Q&A so that we can dig into some of the issues. So I'll just do my share screen right now for my deck, and we'll all cross our fingers and hope that it works. Let's see here. All right, so hopefully you are all seeing my deck right now. Excellent. I'm just going to move away a couple of things so that I can see it too. All right, so today we will be looking at the fundamentals, so 2 fundamentals. First of all, how privacy regulation works in BC, just things to know about our office and sort of how the system works. Secondly, we'll talk about what law applies and when and why it matters. And I do think that that is an important thing for folks in this group to understand. Then we'll look at 2 fundamental issues. The first one is how to hopefully maybe move beyond, I'm sorry, we can't tell you because of privacy. Second issue, please make sure they don't find out I'm the one that told you this information. So it's sort of the opposite of the first issue. And then a moderated Q&A. All right, so that is my boss, the Information and Privacy Commissioner for British Columbia, Michael McAvoy. So the Commissioner's Office is one of several independent offices of the legislature. They receive their budget annually directly from an all-party committee of the Legislative Assembly. So I think the takeaway there is that we are independent from any ministry, independent from any political party, and we have several functions under the 2 enactments that I'll be speaking about today. We can review complaints. We regulate the entirety of the public sector, the health sector, the nonprofit sector, as well as the private for-profit sector in BC. We provide free assistance to small business owners, government agencies, government ministries. And we do have the power to enforce the law if necessary. I'm pleased to report in my 15 years or so of working at the office, most of the time we are able to resolve things amicably between parties, but we do ultimately have that authority if we think that someone has either should share information that they're not sharing or that they have invaded someone's personal privacy. Just wanting to really emphasize that we help. I manage a team of several people who on a daily basis will return phone calls, emails. Many of us are legally trained and we're really here to serve British Columbians. So please don't hesitate to reach out to us. This is just a shot of our website. So if you do go to oipc.bc.ca, there's a variety of different resources. You'll see there we have our guidance documents tab, and we have several guidance documents there, including this one, disclosure of personal information of individuals in crisis. So I will be going into some of the content of that guide today, but I certainly wanted to make you aware on the previous slide of where you could find that information. This is another resource that was produced by the government, not by our office, but it's very useful and I wanted to bring it to your attention. So this is Appendix 13 from the 2005 Guide to the Mental Health Act. So it's, I just grabbed the first page here, but it's going to give you sort of a plain language overview of some of the issues in the FIPA Act. Just for some of you on the call, you might hear it called FOIPA, FOIP, FIP. It's all the same law. It's the public sector privacy law. And we'll be definitely speaking about that more today. Oh, I should say the association, and I might add too, I've just been absolutely in awe of the breadth of the activities of the association since learning more about it, and just so impressive. And I was hearing earlier in the meeting, the 40% increase in calls during this difficult time during the global pandemic. So it's wonderful that they link to this resource as well as several others. All right, so now we'll get to sort of the classroom portion of learning things. And this will be a bit of level setting because I'm sure many of you work for public bodies or some of you work for organizations. So you may have varying familiarity with the privacy laws. So FIPA, as I'll call it, I think I told you it goes by many names. It has two main areas. It's access and its privacy. So part of the act, journalists, public interest groups, private individuals can all make an FOI request for records. But as some of you may know, making an FOI request can take a lot of time. And in situations of serious mental illness or psychosis, you just don't have that time. So today I'm talking to you about other parts of the FIPA legislation that you should be aware of that may give you some ability to press forward when you're having challenges with getting crucial information you need to support your loved ones. One thing I will point out, though, is if you do choose to use the FOI program, that does take a little bit longer usually because for a variety of reasons, but you can FOI any record. So it can be your own records, your loved ones' records. It can be about how a public agency has spent money, what kind of deliberations they've had on various issues. It's a very powerful transparency tool. So the last bullet here, public bodies also have discretion to give you certain information without an FOI request. And that's what I really want to talk about today. Those times where, a health authority or another public agency might say, oh, you can put in an FOI request. And you can certainly say, thank you, I know that I can, but that's not what I'm talking to you about today. So just definitely wanting to introduce you to some of those valuable concepts. I should also add at this point, and I'll try to reiterate it again, the last thing I want to do is give false hope. I mean, we do have these access and privacy laws. They do inherently place limits on what information people can get. And I think we can all guess that there's many situations when that's a very important principle. So the concepts that I'll be introducing in the next 20 minutes or so, they're not silver bullets, they're not going to solve every problem right away, but they're important, they're substantive, and they're things that I think that you all deserve to know about if you don't know about them already. So I've spoken so far about the FIPA Act, the Public Sector Act. This is another law that I'm going to talk about for a second that's important for you to know about if you don't already. British Columbia is one of 3 jurisdictions in Canada that has provincial private sector privacy law. So it's BC, Alberta, and Quebec. So this is the law that is going to apply to your GPs, any health practitioner that does not work for a health authority. So a private clinic, a nutritionist, a clinical counselor. It gets a bit tricky, right? Because there are obviously clinical counselors and psychiatrists who work for health authorities. They're going to be covered by that other law that I talked about. But for all of their clinical work outside of the health authority, it's going to be this PIPA law that applies. Now, PIPA applies to the for-profit and nonprofit sectors. BC is the only province in Canada that does not have comprehensive health privacy legislation. So in the absence of that, we have the FIPA law applying to the health authorities, and we have the PIPA law applying to the GPs and the other practitioners when they're sort of in office. So that's just sort of an important thing to know. Under the PIPA law, you can only quote FOI information about yourself. So remember a few minutes ago, I said with a health authority, as a citizen, you can FOI anything you want and make a request for it. The PIPA law lets you only FOI or make a request for your own information. But PIPA also has an area where you, without having to make the equivalent of an FOI request, you can also ask the organization, AKA the GP or the practitioner, to disclose information to you about your loved one, even if they don't have their consent. There's a few provisions for that I want to talk to you about today. Okay, so issue one, how to move beyond. We hear it in the media, we hear it from various different agencies, and most crucially, when you're trying to get information about your loved one, sorry, can't tell you, privacy. And what I would want to invite everyone to do is to try to productively push beyond that, right? Like, okay, I understand that you're saying I can't get that because of privacy. Can we please talk about that? I think before I get into the nitty-gritty of the sections, I just want to say that health authorities, most of them, in fact, all of them, have privacy staff. They have people on staff. So you may be dealing with an exhausted frontline worker, and privacy may or may not be their area of expertise. And if they say to you, I can't talk to you because of privacy, I would encourage you to reach into the health authorities, staffing, or ask to talk to the privacy office or the privacy officer until you find somebody where privacy is their main job, just like it is for me. We deal with this stuff all the time. I have relationships with many of the privacy professionals that work at the health authorities. These are the people who will be able to sort of make the call about whether the health authority can perhaps exercise discretion to provide you with some information under the FIPA law. The other sort of tip I'll give out is if there are several caregivers, that oftentimes the health authorities have more privacy experts on staff than, say, a GP, who might just simply not have the resources to have, a whole team of privacy professionals working behind them. So if you think that the information is both with the GP and with the health authority, for resourcing matters, I would suggest that you start with the health authority and move beyond just the clinician, because the clinician is an amazing expert in delivering primary care. They may not have as much time or capacity to deal with some of these legal privacy issues. The other thing I will point out at this juncture is that some of the provisions I'll be talking about also apply to municipal police departments. So, the Vancouver Police Department, the Abbotsford Police Department, Victoria Police Department. Our provincial privacy laws, though, do not cover the RCMP. They're going to be covered by federal legislation. So it just depends where you live and what police department you may be interacting with. But again, many of the regional municipal police forces in BC have privacy experts on staff that you can try to connect with. Let's get into the provisions. So the first bullet is one that many of you have probably heard before, from your loved one, from your family member. If there is ever a point in the relationship where you can get consent, then consent is a great thing to have. So, it's a matter of talking to your loved one, talking to anyone in the community of care that's helping this individual. And if they're at a point with their health where they're able to sit down and sign a document saying, I consent to, my mother, my father, whatever, getting the information, then documenting that is great. If you ever were to need help with that, you can certainly call us. It's just, our contact information is right on our website. There's about 50 of us working at the office. It's not huge. And usually within 2 business days, you will get a phone call from myself or one of my team, or an email back with answers that you need, or we could review a consent for you and give you our feedback about it. So I really wanted to stress that we are here for British Columbians. So now I'm going to talk about 2 sections of the FOI Act that you should be aware of if you're not already. You'll see on the second bullet there that I've put in brackets part 3. That's pretty important. The first bullet there has parts 2 and 3. So part 2 is the FOI part. And probably I'll be so interested during the Q&A, if you've tried to get information before, again, you might be told, and well-intentioned, please make an FOI request, go make an access request. That's part 2 of the FIPA Act, which is quite large. What I'm talking about right now is part 3. So we're not talking about making an FOI request. We're talking about the public body, the health authority, the police department has this, the school district has a body of information. And these provisions in yellow here allow them, without an FOI request, to exercise their discretion to release information to you. So the first one is, if the public body determines that compelling circumstances exist that affect anyone's health or safety, and that notice is mailed to that individual unless it would cause them physical or mental distress, right? So that's really pertinent to this conversation today. So I would invite you that if you're in a situation with a clinician at a public body or with a law enforcement agency saying, we can't give you this information, you could push back on that a little bit and say, look, these are obviously compelling circumstances. I need to find out this information because, right? And sort of making your case. And then pointing out to them if they don't know already. And we don't need to tell this individual, because under the law, if we mail them notice, it's going to distress them. And it's written right here into the law. Now, here's the part where I don't want to offer false hope. It is the public body that ultimately has the discretion to release that information or not. I have had some situations, not in the mental health care context, but in other contexts where, for example, I've had one where a school district, the family wanted to get some information about the student, and the school district said, we know we have the authority to exercise it, but for these various reasons, we're not going to. Our office does not have authority to exercise discretion for the school district or health authority or police department. However, in my everyday experience working at the commissioner's office for over a decade, oftentimes, usually, if there are compelling factors, then the public body is usually just scared to give out the information. They think, oh, we're going to break a privacy law if we give out the information. That's where, if it's of interest to you, you can actually call up our office, and we often will be that independent third party with the voice of authority, because we oversee the acts. And I have been on the phone with nurses, I've been on the phone with GPs saying, you can exercise your discretion to release this information. I am telling you this. I can't exercise it for you, but I can either put it in an email or on a phone call with the GP or the patient and just walk them through the options that they have available to them, because they simply might not know what options are available to them. They're really busy providing primary care or providing law enforcement. So definitely we have that education function. The other section that I wanted to bring up with you is there is a provision to allow for the disclosure of personal information if the purpose is to reduce the risk of domestic violence. So this becomes potentially, significant for some of you, because domestic violence includes sexual abuse. It also includes physical abuse of a child. So it could be an adult child, it could be a parent. You'll see it down there. I've just pasted it directly from the Act itself. So if there is a situation, for example, where a parent is concerned that their adult child may cause them domestic violence, this section is designed for a public body like a police department or a health authority to disclose information to the family for the purpose of reducing that risk. So again, I can't begin to imagine all the individual circumstances that many of you are facing, but if you start thinking about those factors and connecting the circumstances of your own situation with the wording of these provisions, you can sort of start to see how they might apply, and that you could talk to the privacy experts at these public bodies about, hey, is there an opportunity here for me to get access to more information? It might not be everything, but maybe it's something. And that's a conversation you could have with the privacy officer at the public body. And once again, if you're not getting anywhere, you can try giving us a call and we'll see if we can help. All right, I've got about 10 minutes left, so I'll just move through a couple of more slides. So now we've been working over with FIPA, the public authorities. Now we're going to look at the similar provisions that exist in the PIPA Act. So this is with your clinical counselor, your psychiatrist, psychologist. It could be a business owner as well. Like I said, this law applies. It could be an association or a nonprofit organization. These are all within the PIPA bucket. So PIPA is a consent-based law. It's mainly a consumer law. So it's a tough fit, right? Like I can really empathize with folks trying to get information in the healthcare space, because PIPA is a law of general application that applies when you're buying a coffee or buying jeans at the mall or getting your health information. There is a section that says that an organization can disclose personal information without consent of the individual the information is about if the disclosure is clearly in the interests of the individual and consent cannot be obtained in a timely way. So if you think that your family is in crisis and having a situation where that might fit, I would draw that section to the attention of the organization. I'll tell you that a lot of healthcare providers don't actually know about PIPA, and they don't know about these sections. So you may need to educate them about it. The second bullet here is going to look very familiar from FIPA. There are reasonable grounds to believe that compelling circumstances exist that affect the health or safety of any individual, and if disclosure is mailed to the last known address of the individual. So this law is a little bit different, because in FIPA, there's a section that says you don't have to mail notice to the person if it's going to cause distress, right? Which in many cases, I imagine it would. So that's another reason to try to go the FIPA route first. I would recommend that. In PIPA, there is the discretion to disclose the information to you, but they must mail notice of the disclosure. Now, noteworthy here is they just need to say, I, Dr. So-and-so, disclosed this information to this person. They don't need to say what precipitated the disclosure, right? So it does not need to say, they asked me for it, therefore I gave it to them. It could have just been, so that part does not need to be revealed, but the fact of the disclosure does need to be revealed. The last one I threw in there because I was really looking over the sections of the Act to think of anything that could apply. And it's an outside chance, but I wanted to draw to your attention that a personal information, if someone's at a performance or a sports meet that's voluntary and open to the public, then an organization can disclose that information as well. So if someone, it's a long shot, right? But I wanted to put it in there. If there was a GP or someone you knew in a business context where they had seen someone potentially acting erratically, or whether they'd seen them at all, like, have you seen so-and-so at this event? Then they're allowed to disclose that information without the person's consent. So I just wanted to add that one in there as well. Okay, let's move on. All right, so issue 2, please make sure they don't find out that I'm the one that told you this information. So we'll move on to sort of the opposite of what we were just talking about, right? The first one is you want to get that information. The second one is you want to give credible information to, say, a healthcare provider or a law enforcement agency, but you don't want it traced back to you. Depending on the circumstances, obviously, the first option is you can mail in some information without your name on it, or you can send in an email from a not easy to trace email address. I know with the commissioner's office, we have lots of sort of quote unquote whistleblowers, right? Who will say, anonymously, hey, I think you should go check out this, or I'm an IT specialist and I want you to go check out that. And it's very valuable. So, that's an option on the table. But let's talk about the more common situation where, the GP is going to know who you are, or the health authority is going to know who you are, and you're giving information, and it's really important for your safety that that individual does not find out, or even if it's not your safety, you want to still maintain a relationship with that person. So you never want them to know. The first thing to know is that absolute confidentiality does not exist. So if anyone tells you, there's no way anybody can ever find this out, that in my view is just inaccurate, because the law does have carve-outs. Having said that, it's extremely unlikely. There are just layers and layers built into both laws to protect you in situations where you're telling somebody some information and it's really obvious, like, hey, this person cannot find out that I said this, or they'll never talk to me again, or they'll hurt me. So there's a lot of protection there. The balance is definitely in favor of not disclosing it. So this is where it gets a bit complicated. I'll just briefly go over it, but please follow up if you have any more questions, either today or in the future. Let's say, for example, a patient wanted access to their mental health records. the health authority might, let's say they know about part 3. They say, I don't want to make an FOI request. I just want you to tell me who told me this information. In my experience, the health authority will always say, no, we're not going to exercise our discretion. And what they may or may not say to the person is the reason they're not going to exercise their discretion is because then that individual is going to go try to harm that individual, or that individual is, going to get really upset and never speak to that individual. So health authorities are not inclined to exercise discretion in those circumstances. Under that situation, the patient in this example, or anyone for that matter, can still make an FOI request. They can FOI anything. That's where Section 22 is your protection. Section 22 is mandatory and says that if it would be an unreasonable invasion of a third party's personal privacy, aka yours, if you've given up some confidential information, the public authority is prohibited by law from releasing it. So we have case after case after case of that happening where information has not been disclosed. The other thing in PIPA with the GP is that that law just straight up prohibits it. It doesn't even say if it's an unreasonable invasion of your personal privacy. It's that if a patient were to ask, who gave you this information, they just straight up can't tell that person who gave up the information. So there's a built-in protection right there. I think my next slide, I've got just a case example in the couple of minutes I have left before the Q&A. Yes. So this is one of many orders on our website. And an order is when someone's complained because they haven't got the result they want. They complain to our office. We haven't resolved it informally. So we actually have order making power to either order a public authority or an organization to keep the information or to release it. And if the individual wants to appeal, at that point, they have to go to the BC Supreme Court. So in this case, a patient had FOI'd her mental health records. And as the adjudicator noted, the only record in dispute is a one-page record of a telephone call made to the board about an applicant's state of mind. The board had withheld portions of the records that would identify the caller. So they didn't withhold the whole record, but they definitely withheld anything that would reveal, and sometimes the content of the record itself, right? It would be obvious who revealed that information. So the authority will withhold that, they have to. So in this case, the commissioner confirmed the authority was authorized to withhold the information on the basis that could harm someone's mental or physical health. I won't get too legalistic here, but this was Section 19. So in addition to Section 22, protecting individuals, you've got Section 19. Like I said, there are just layers and layers of law to try to protect individuals in this circumstance. And like I said, the only caveat I want to give you is that if people say your confidentiality is absolutely guaranteed, it's not. There are, it is hypothetically possible that the information could be released, but I'm hopefully giving you confidence and comfort to know that you could reveal sensitive information about another individual and that there's an overwhelming likelihood that your information will be protected. Absolutely. We get a lot of this with family members calling into the government superintendent of motor vehicles saying that someone's drinking again and they should have their license pulled back. And I don't know of a single case where the individual has ever gotten confirmation from the government of who called to say that they were drinking again. So that's a very common example. So I guess without further ado, I will turn it back to Phaedra for the moderated Q&A, and just wanted to thank you very much for your time. I'll stand by.
Caitlin, wow, that was fantastic. As we talked about, we really wanted to talk about issues and be able to arm our families with information, and you captured the information beautifully. So thank you.
Thank you.
And not only did you capture the information for our families, but also for those frontline clinicians working in the field. So thank you again. And now for you, our audience, you have the opportunity now to ask Caitlin any question that you would like. So please use the Q&A box to submit any question you may have. We are going to do our very best to be able to get to every single question. We may not be able to though, so just a FYI. So if one of your questions does not get answered though, we will be working with Caitlin and her team, as she mentioned earlier, to get your questions answered. It may have to be in the future, but I know Caitlin will get on it as quickly as she can. So at BCSS, a lot of our families, as we know, are facing a lot of challenges and issues and some very common issues. So here's a common scenario that we at BCSS hear quite often from our frontline team. My son is 19 years old. He is currently in an acute psychotic state, believes the entire family is out to get him. He doesn't trust any of us. He's been in hospital for the last month and nothing has changed. I want to protect my son. I want to help him. What can I do to be able to act on his behalf while he is in hospital so we can help him get better? Caitlin, over to you.
All right, absolutely, Phaedra. Thank you for that. Well, two things come to mind. The first thing would be, if you haven't moved beyond the direct clinical care, and by this too, I just want to be very clear, this is in no disrespect to the direct clinicians providing the care, but if you haven't moved beyond the privacy we can't tell you phase, then I would look up who the privacy officer is, and say, look, I'm talking, the clinical care team has let me know they can't give out this information. Can I talk to you about maybe some other options? And you may hear, well, certainly you can make an FOI request, and then you say, thank you, I understand that, but there's this section that says that there's compelling circumstances that you could disclose the information. And then the family might say something like, as it's very clear, and maybe, they can give examples that our son lives at home, or he's very close in our lives, he comes and visits all the time, or my son's partner and I are, very close. In the situation where he's has severe mental illness and is in psychosis, in my point of view, those are compelling, and I'm just pretending I'm the parent here. These are a compelling circumstance where I need to get some information about his condition, his care, what I can do for the purposes of helping his treatment. And I think really talking to the privacy officer about that and seeing what they say back would be really a good first step if they haven't done that already. And let's say they do talk about it and the privacy officer says, look, I'm really worried about infringing the patient's privacy, and I just don't think I can exercise discretion to give you any of this information. I don't think it's a compelling circumstance. Then you might, and again, I don't want to promise that we're a magic solution, but you might say, okay, I think I might call the commissioner's office to talk about this. And they'll say, okay, fine. So you call up the commissioner's office and then maybe work through, again, like what are the circumstances that are happening? What are your goals with trying to receive the information, that sort of thing. And then depending on the situation, we can either send you an email stating what we think the law is and how permissive it is. And quite frequently families would forward that to the health authority just to kind of give the health authority the confidence that the regulator is not going to say, oh no, we're coming after you for disclosing this information, right? Because I understand that it's unfortunately, from a purely legal perspective, it's less risky to do nothing than do something. And I think that's where our office is the greatest role we can play to give those professionals in the health authorities confidence that they can exercise their discretion. So that would be one tact. The other thing I would do is suggest the domestic violence. If there's been any history of violence, looking at that section and saying, okay, well, maybe you don't think that there are compelling circumstances. We'll have to agree to disagree on that one. But what about this domestic violence? If you disclose to me information about his care, it's going to reduce the chances that he will get hurt and that I will get hurt. Because remember, that provision says if anyone's at risk of domestic violence. And basically just continuing the conversation. That would be my recommendation.
And Caitlin, that's why we're so happy to have this conversation with you today, so our families can see you and get the information, get your website, get your email. So it's just, like I said, another resource for our families to be able to get the help that they need. So thank you for that. Okay, now we're going to do the flip side. So now we're going to hear from a frontline care worker, frontline clinician. So Colin is an ER nurse. He works in many communities across northern BC, Caitlin, and he shared this scenario with us. And he said this is a very common scenario for many nurses that many BC nurses experience. So the scenario revolves around privacy rights and the plan of care. So here's the scenario. So a patient, we're going to call him John, is brought to the ER by RCMP and EMS. The patient has not been taking his medications for approximately 2 weeks, and he has been using cocaine for the past 4 days. John has been aggressive, both to himself as well as to his family. John's sister, Zoe, follows the RCMP to the hospital And she explains what has happened over the past 2 weeks, John's risky behavior, and that previously Zoe, John, as well as the family GP were all involved in his care planning. But since John and Zoe lived together, unfortunately, the GP is retired 4 months ago and there is no replacement. So given the poor psychiatric bed availability, John remains in a very rural emergency room until a bed becomes available. And over the course of the next 10 days, 4 of which he was in a lockdown seclusion room, the regional on-call psychiatrist has assessed John over Zoom. And upon discussion with the ER doctor and the psych on-call, the decision is made to discharge John because he had met all the points of discharge criteria. So when discussing the discharge with John, he states, do not tell Zoe any of this. She locked me up. I don't want her to know anything. I'm not talking to her. I'm just going to figure out where I'm going to live by myself. Do not discuss this with Zoe. And remember, they lived together.
Mm-hmm.
So while John was previously committed, he had now been fit for discharge. So what do we do, Caitlin? So what, if anything, can be relayed back to Zoe, obviously given John's comments and John's rights? And what if the RCMP want to be notified of John's discharge to ensure a keeping of the peace should it be required? So 2 questions there. So what information can be relayed to Zoe, because she obviously wants to know as John's caregiver or one of his caregivers, and the RCMP, and what if the RCMP wants to be notified of John's discharge based on his past history?
Absolutely. First of all, such a harrowing, but I'm sure all too common scenario. I have a couple of young children, and I can only imagine as a mother, how it would feel to have to deal with something like this with a child or a sibling or any loved one. I think there's a few things that Zoe can do. So one thing is, if she hasn't started already, papering the relationship, to say. So if there has been a history of care, I know in this example, the GP has retired, but just trying to find any proof, either rental agreements or any documents to just prove that, like, hey, he lived with me and we had this relationship, any emails or things that might show that closeness, that relationship. So that's something that she can have on hand. Privacy, like a lot of different legal fields, is all about context and the facts of each specific case. So here Zoe has a lot to work with, and I will get to the RCMP part in a minute. But so Zoe's going to the health authority and saying, look, he lived with me. I know whatever he's telling you right now, that he doesn't want anything to do with me. He was living with me right before he was hospitalized. I was part of the care plan with the GP. And then say to the health authority, look, this is a special situation. The GP has retired. So, he or she is not available. They are not available anymore. That's another unique circumstance. So he lived with her, GP's retired. Maybe there's not parents involved. Perhaps the parents are deceased or there's something else. So it's like, hey, this individual doesn't have anybody else, and try to show evidence of that. There's another factor. So it's just building up these factors where you talk to the privacy officer, the risk management officer at the health authority, saying, these are all factors that to me are compelling circumstances. Let's say if she may know that he was using cocaine. So he's been using cocaine. He's been hospitalized for a long time. This is, even if he's fit for discharge, he obviously was experiencing severe mental illness based on the length of hospitalization. These are all factors, health authority, why you should exercise your discretion to disclose information to me about either where he is or, whatever information that, so this is where it's interesting too. Like, they may say, well, the health authority, this is a good thing to bring up. The health authority, let's say we get involved. Let's say the health authority calls us or Zoe calls us. We can confidentially hear from the health authority all the information that they have. We have the section 47 of FIPPA. We're required to keep that confidential between, so what I guess I mean is the health authority can test it out with us. They can say, Caitlin, this is all the information we have. We want to tell Zoe this information. So I could then have a call with Zoe and say, Zoe, they've actually told me everything everything that they've got, and they've told me that they think this part will meet meeting the compelling circumstances. And I sort of as a third party can say, yeah, you know, that's going to help Zoe. It might not be absolutely everything she wants, but it's certainly going to be better than nothing. So you would do that. And then you would also repeat that exercise for the domestic violence provision, because in this case, if he's been violent and if they're living together, then it's like, hey, you know, it's a risk to his safety and a risk to my safety if you don't give me this information. So please exercise your discretion to give me this information. There's another section of FIPPA that I'll bring up briefly. I didn't have a whole slide on it because it's a high bar, but it's called Section 25. And this is where a public body must disclose information, regardless if anyone's made a request or not, if there's an imminent threat to a large group of people or a smaller group of people. To give you an idea of how high the bar is on this one, we frequently get notifications when dangerous sexual offenders will be released into a community. So that would be an example where a municipal police department would put out a notice and sometimes a photograph saying like, this person is being released into this community. That's a Section 25. But again, I just want to put as many tools in the toolkit as possible. If this person has had like a long, say, criminal history, you might invoke that section with them and say, look, there's this other section of FIPPA that says, you know, you have a duty to release this. So that's another provision. And that would potentially also be the section that the health authority would use to disclose to the RCMP. So the other option is with the RCMP is, I'm not an expert on the federal legislation that applies to them, but there is a section the health authority could disclose to a law enforcement agency as part of an investigation. So obviously, if the RCMP have an open investigation on the individual, then that would enable the health authority to disclose information to the RCMP to support their investigation. So I think what I want to say is that they're called privacy laws, and they are, but really they're privacy laws that each have a whole list of enumerated things of situations, and you can kind of like nudge at each of those situations. It's not always going to work, but I think a lot of times people don't realize that these are available.
I feel like, Caitlin, we're going to need a summary document, or just because there's so much valuable information. And as you said, it's not black and white. There seems to be a lot of gray, and we just want to be able to give the family members that we work with on a daily basis as much information as we possibly can, so they can better work with their clinician in their lives with their loved ones. So thank you for that information. And there again, for everybody that's listening, you will have an opportunity to ask questions, but here's another situation that comes up frequently for our family members. So Caitlin, here's another scenario that we hear quite often. So my daughter doesn't want me to know what is happening. She doesn't believe she has a mental illness. She doesn't think that anything is wrong, but I know that something is not right. All I want to do is help her. I want to help her get the help she needs it when she needs it. So how can I find out, for me as a mother, what's happening in my daughter's life?
I mean, thanks. I'm just letting that one kind of sink in. It's all the things I've already said, but I'm trying, like, it's the same exercise over again, but I'm just trying to think of any other possible way.
Mm-hmm. And take your time, because this is a common one. This is a big one for our family members is, I mean, obviously family members are there to support and get help for their loved one. And this is something that we as family members and our family members come up and are faced with a lot. So yeah, any information will be appreciated. So take your time, Caitlin.
Thanks. I think in that case, in this situation and in others, I did say FOI requests can take a long time, and they can, but that doesn't stop you from filing an FOI request. So if you know, like, I guess what I mean is it can't hurt, right? Like in this case, if the daughter is being cared for by a health authority, then the mother could just put in the FOI request that day, like, dear health authority, I want records about my daughter. The health authority should respond within 30 days. They may write back and say, no, you can't get information about your daughter, at which point you can then file, and it only takes about 10 minutes for each thing. You can file online a review by our office. It'll take a couple of months, but somebody will review the file and will work with the health authority and will spend hours trying to see if there's any way that that it would not be an unreasonable invasion of the daughter's privacy for the mother to get the information. So that's one way. Another way is that, and I don't, this is where, Phaedra, you'll be much more of an expert than I am, but under FOI, if someone has a representation agreement or is a legal representative of the individual, then they can make an FOI request on that individual's behalf. So it bears mentioning here, it doesn't always work, but if they can show that they're making the FOI request in the interests of the daughter and not in their own interests, then they can take the place of the daughter and then get the information. So in one scenario, mom might make the FOI request saying, hey, I want to know as the mother what's happening with my daughter. That's a tough one, but it's still worth making the request. The second way is I'm making the request as mom, but I'm doing it like on as if I was the daughter, right? And then you have a higher chance of getting the information. So that's another path. I would also step back and think, okay, where are all the data points that my daughter has data? So she might have a clinical counselor, she might have a psychiatrist, she might have interactions with the police that the mom might not even know about. So I would just reach out to various authorities, public authorities, the library, the school, all these places, and see if there's anywhere that you can gather data points about an individual. I mean, I could give a whole other talk, and I won't right now, about the online world too, right? Like people leave a lot of digital trails in a lot of different places. So you kind of have to become a bit of a detective and see what places you can collect some data or get some information, make little inroads. Even if you say you have no reason to think the daughter's been involved with let's say the Vancouver Police Department, throw in an FOI request and they might say, we don't have anything, or they might say, we do have stuff and we can't give it to you. So, you might learn something there. I guess it's about getting creative, if I have to put it that way.
And as you said, being a detective.
Yes,
yeah.
Very much so.
And there again, being a detective, but knowing what resources are available is critical. It's essential that our families have this information, and also from a clinician standpoint as well, that both parties have this information. So thank you for that, Caitlin. Okay, so now this next story, we have a video, is from one of our family members, which there again, unfortunately, is very common.
Hi, my name is Michelle and I am married to Dean. Together we have 5 children and life is pretty good. We have been married for 12 years. We have our first grandchild on the way, but it always hasn't been this way. 4 years ago, my husband had a psychotic break, which put my life and 3 of our children's lives in great danger. And my husband was taken into the hospital by the RCMP, specifically CAR 60, under the Mental Health Act, where he received a diagnosis of schizoaffective disorder. He remained in hospital for about a month before he was released to come home to me and the children. And for about 16 months, my husband was stable and life was okay. Then I saw a great decline. I noticed that my husband wasn't eating meals with us, and if he did eat anything, it was candy bars and Diet Cola. He wasn't interested in anything in the children's lives, homework, concerts, field trips. He was hiding in the basement from life. I counted 22 days without my husband having a shower. And every 3 months, my husband would have a check-in and prescription refill with his family doctor. And if I could, I would go and I would address these concerns. And I was told, Michelle, you're not my patient. Dean is. Dean's sitting here. Look shower to me. He's talking. He's telling me that everything is fine. So I'm going to go with that. And the doctor would send us on our way. This went on for months. And then it got really bad. I had a project at home where I needed chain by the foot. And being a busy mom of 5, I tend to leave things to the last minute. So we were in a rush. The kids were going to be home in about 15 minutes. But we ran to Canadian Tire to get some chain by the foot. And instead of helping me pick out the chain, my husband was down the aisle checking out some rope. And I didn't see it for what it was at the time. But my husband had picked out this lovely red rope and he would pull it out, give it a little test, roll it back up, feel how soft it was, pull it back out again. And I said, we don't have time for this, we have to go. So we bought the chain and we left. And then the next day, Dean had an appointment with his IPT team leader about programs. And before Dean even got home from that appointment, his IPT team leader, Crystal, had called me and said, Michelle, Dean's really high risk. He has a plan, and that red rope was a really big part of that plan. You need to get him to the emergency to see the doctor or a psych nurse if there's one on call. And I want proof that he's there, or I'm calling car 60, and Dean will be picked up underneath the Mental Health Act. So when Dean got home, he goes, I know, we're going. So we got a babysitter for the kids, and off to the emergency room we went. Dean saw a psych nurse, and we told them all our concerns. I told them all of mine, and still Dean was released to come home with me with a promise to see a psychiatrist at the health unit in 3 days. So in 3 days, we arrive at the health unit. I drop Dean off at the front doors to go check in while I park. I did not get our car parked and get inside the building before my husband was standing outside holding 2 pieces of paper printed from Google on how to change your medication at home. I told Dean, this is absolutely ludicrous. You put our lives at risk. I can't live with you doing this. So Dean took me seriously. He phoned his family doctor and said, look, my wife says no. Now, the medication my husband was on, he was on the highest dose that was proper to be in Canada. However, they had allowed a higher dose in the United States, and the doctor felt that it was quite safe to do that. So my husband's dose was raised and life went on. Eventually, my husband ended up having a complete medication change, which was done in hospital under the supervision of a psychiatrist. Lack of communication with my husband's mental health professionals, his family doctor, has always been lacking. And so my question is, when my husband does not have his mental illness in check, when he is not well, he poses a great risk to me and my children's lives. Who do I talk to? Who do I tell my concerns to when his family doctor is not interested and I'm often disregarded? Who do I talk to? Where do I go before my husband has another plan and something really bad happens?
First off, Michelle, thank you for having the courage to share your story and to ask your question. So thank you for your courage and your bravery to talk about it. And Caitlin, this isn't something that is unusual. So what advice or information can you pass along to Michelle and other family members in Michelle's situation?
Absolutely. And I just wanted to emphasize how brave and important that video was, how amazing. Okay, so I mean, obviously part of that is going to be clinical information, not purely privacy, but from the privacy perspective, I would, and it sounds like Michelle is very organized in this regard. So I would call a few different people. If the GP isn't providing the adequate care, call the health authority. Like, just keep calling everybody. Call the health authority, explain the situation, say it's inadequate. Call I hope it doesn't sound trite because I'm not meaning it to be. It's like call 811 because those provincial people often, even the health navigators, might know about programs. Again, I would even say call your MLA, pardon me, your member of the Legislative Assembly. The commissioner in the privacy context, the privacy commissioner does work for the Legislative Assembly, and he will work directly with MLAs who have heard from constituents. It's worth doing. So definitely reach out to your MLA. There's also the representative for children and youth. So that is not MCFD. That is another independent office of the legislature. They may be aware of resources that are available. They may have legally trained people to assist you. I would also call, and this is a point I meant to make earlier. So we are the independent office and the privacy regulator. We're legally charged with enforcing the privacy laws. However, the BC government staffs its own suite of privacy professionals, and every single ministry, including the minister that we heard from earlier today, they will have a ministry privacy officer who may be able to assist. So you can just literally Google ministry privacy officer and the emails and phone numbers and names will pop right up. And just keep talking to somebody until you find somebody that will get you the help that you need. Try not to give up. I know it would feel easy to give up, but there are so many different avenues, especially, I'm a transplant. I grew up in the Lower Mainland. I live in Victoria now. There are so many different agencies and offices out there, and to just try to keep calling people. I will try to call people if I can. So if people are saying, hey, look, I can't find anybody, even if it's not a privacy issue, I'll try to think through in all my years in government, who can I connect you with? I know there's some really great people at the Ombuds person's office as well. They'll deal with issues of fairness. If they're saying, hey, I'm not being treated fairly by this organization, they're there to help as well. And we're all paid by you, the taxpayers, to get you the help that you need. So that would be the best suggestions that come to mind in what is obviously a very difficult situation. Actually, the last one that came to mind as well is it doesn't hurt to go talk to the manager of the store, right? Because various stores have various abilities to track and block shoplifters. They can also potentially, if you get somebody, they might be able to tell you phone me, here's my phone number. If you see my husband come into the store, phone me, because there are compelling circumstances that affect my safety. And you might get a store manager doing that for you.
Good tips. Thank you, Caitlin. Okay, now we're turning it over to you, our audience. Please feel free to write any question you have. No question is off limits. Please put in the chat box. We will try and get to it today. But as we said, if we're unable to get to it today, Caitlin and our awesome team will jump on it. And I know Caitlin will follow through with this one. I've met with you enough, Caitlin, to know that. So I can assure you
I will.
Caitlin and our team will. Yeah.
Yeah.
Okay. So questions in the chat box. First question. So it was just so nice to hear the scenario questions from our families and from Colin, the ER nurse, but now these are specific questions from you. So first question, since we work with families of people with serious mental health problems, what is more relevant for us is how can a parent or a partner obtain information about their loved one's condition, treatment, etc., on the basis that the patient is not competent or is at grave risk?
Okay, thanks. So if I'm understanding it correctly, like from the perspective of an organization such as yourselves, such as BCSS, if family members want information about loved ones suffering from mental illness, like how to get it from the organization itself, Phaedra?
That's how I would interpret it as well, Caitlin. Yeah.
Okay. Okay, so there's a couple of options. Okay, so obviously we're going to assume that the person doesn't consent, and I'll start with that. And now that being said, again, it can change, right? Like there might be in the continuity of care, the person's illness at a point where they do consent. So that's always something to keep revisiting, but we'll assume that they don't consent. I would reach into those same situations that say there's compelling circumstances. So I know I keep saying that over and over again, but in this case, the family member, well, two things. So if the person's not competent under the PIPA regulations, again, you can make a request on their behalf. I don't have the regulation in front of me, but I believe it's the Patient's Property Act or power of attorney. So I mean, in several legal definitions, I guess the message I want to give today is it is spelled out in the PIPA regulation or the FIPA regulation. You can find those readily on our website or email us. It will explain that, like, if, for example, you're a representative under the Patient's Property Act, you can make a request to an organization as if you were that person. Like you can, and get the information. So that would be the way that you could do that. If you don't have that, because obviously it's a pretty formal legal thing, then you would just appeal to the organization to exercise discretion to disclose the information to you and explain why.
Okay, thank you. So we've heard, so this person, requesting answers to this question, Caitlin, she says you've touched on this, but she'd like more information. So she says, my son's doctor and case manager have said that they have to tell my son if he asks that it was I, his mom, that told him something. And we do hear this a lot. So in other words, so she's saying, so my son's doctor and the case manager have said to mom that we have to tell your son if he asks that it was you passing along the information. So my interpretation of this question is, what are her rights and is that the law?
Right. So with the greatest of respect to the clinicians, it sounds like that is not quite accurate. So if we're talking about PIPA right now, and it sounds like it sounds like we're talking about the GP in their office, not at the health authority. So I'll go with that for now. I could do both actually. So if it's the GP, it would be Section 23 of PIPA does give the child, for example, let's say the patient, the ability to go and say, okay, I am asking you under the law to tell me who you've given my information to and who you've collected my information from. That is not then there's a list of exceptions, and one of them could be if someone's harmed. So in that case, I would push back to the doctor and say, like, can you tell me, not even push back, but just could you please explain to me under what law you have to tell my son that information, because I don't understand. And if they refuse to tell you, then say like, then I would almost file a complaint with our office, or why don't you just call us? When I say file a complaint, that's kind of the second line, like call us. We have intake staff, we have policy staff that can kind of walk it through. And we might even say like, who's your GP? Maybe could we give them a call if that's okay with, or it's not the woman's GP, it's her son's GP, but who's the son's GP? Who are you having a problem with? We would probably call up, we either talk to the GP or the MOA and just get a little bit more information. And a lot of what we do again is educate MOAs and doctors, because they don't get a lot of this education because they're so busy doing their primary practice.
Okay. Yeah, that makes sense. So I hope we answered that question, but if not, if we haven't addressed it, or if I'm not interpreting it correctly, please feel free to follow up with Caitlin and we'll do our best to answer it or provide any more information. So thank you, Caitlin, for that answer.
Thank you. And yeah, I really hope the person does follow up if they need to. It's info@oipc.bc.ca. You will get a response from a human within usually 2 days, almost always 2 business days.
Yeah. And I like that added part, Caitlin, from a human.
Yeah.
I like that. Yes. In this day and age, right?
Yeah.
Okay. So next question. So if my adult son gives personal permission for his psychiatrist to share information with me, his father, how long does this permission last? That's a good question. So his question is, amount of time. So is that 6 months? Is it 1 year? That's a very good question. So I'll repeat it. So if my adult son gives personal information for his psychiatrist to share information with me, his father, how long does that permission last?
If there's no date on it, it lasts until he revokes it. So it's just a standing consent. Now we have seen cases where for, clinical and professional reasons, the psychiatrist maybe 6 months or a year later may choose to revisit that consent just to be sure it's still valid. But oftentimes it's good to put in a line saying like, this consent is valid until I say it's not valid, or this consent is valid for 3 years. But even if it just says I consent and there's nothing else, then the consent is in place until the person revokes it.
Okay, that's good to know. Okay, so next question. Our families would most likely be looking to obtain information. If notice has to go to the ill person, this could cause that person to avoid both the clinician and the people looking for that information. So can the notice to the ill individual be avoided? It's a good question.
Yeah, that's a really good question. That is where I would really pay attention to. So under FIPA, if it's with a health authority, they don't need to mail it. But if it's PIPA, there's nothing in the law that says they can't mail it. So in that case, you want to kind of look at all the care providers and go, okay, that care provider is under FIPA. So I want to go straight to that privacy officer and say, there's compelling circumstances. I'd like you to exercise discretion to give me information. But then I want you to promise me that you're only going to do that if you agree to invoke that part of the law that says you're not going to mail notice to the last address. And then you get that in an email from the privacy officer, try to get it in writing saying, yes, we're going to exercise discretion to release this information, but I'm telling you in advance, we're not going to do that part where we mail it to the last known address.
Okay.
So was that getting at the question? Whereas under PIPA, if they decide to give you information because it's a compelling circumstance, they have to mail it. There's nothing we can do. The section says you have to mail it.
Okay. Now, Caitlin, on your website, do you articulate what you went through in your slides earlier? So if somebody is wondering, okay, what applies to me as a family member, PIPA or FIPA, and the various sections, you know, as you were discussing the 3.1 for the domestic violence piece under FIPA, is all that information on your website that we could easily access, or is it something that we would have to search for?
Most of it should be, but I'm glad you brought that up, because if it's FIPA, the other thing that's really good is if everybody wants to Google or internet search the FIPA manual. So we don't put out a manual. So it's kind of bureaucratic. The Minister of Citizen Services is responsible for the FIPA law. They don't enforce it, but they write it and they're responsible for changes. So because they're responsible, they've actually published an online manual that gives examples for many of the sections and talks about them. They also have privacy staff that can answer questions. So I would Google FIPA manual, and then you can find all the sections. You can go to bclaws.bc.ca and just find the law and read it. There's no harm in that. And I always tell groups, you don't have to be legally trained, right? Like, you might not understand everything that you're looking at, but it never hurts to go right to the source. We do have on our website a comprehensive guide to PIPA and a comprehensive guide to FIPA, as well as many other resources, including that emergency disclosures document I talked about, which is written in plain language and is only about 6 or 7 pages long. So I think you should be able to find it. And we do appreciate if people do a little bit of digging around first before they call us, but we're always here.
Okay, thank you for that. And I like that plain language part, because, you know, as you were talking about the legalese, it's just nice to have it very simple, very clear what, you know, which law we're talking about, and have it clearly articulated. So yeah, so thank you for that. Clear language is always good.
Yes, we strive for that. And actually just wanted to jump in and say too, that like if privacy law feels hard and convoluted and complicated, it's because it is hard and convoluted and complicated. It's second nature to me because I've been doing it full time for 15 years. So I just want to really, people should be gentle on themselves to know that this unfortunately is kind of complicated.
Yeah, and that just makes us feel better, because you have a background in law, Caitlin. You've been doing this for 15 years. And so that's why it's just so fantastic we have this opportunity to speak with you today. So next question. So if mom shares information, doctor or staff usually say that they have to share it. They say they have to share that it is mom sharing the information. Okay, so now I'm clear. Okay, so mom shares information. Doctor or staff usually say that they have to share it, that it is mom sharing the information, that they are not granted confidentiality more times than not. It will sever the relationship. So what exactly can mom say to staff to ensure that her information is not shared, that mom is the one who said this? It is always prefaced, please do not share my information. Please answer under the health authority.
Okay, thank you. It does surprise me a bit. Like I believe the answer that they're saying this, but it surprises me that they're saying this. So 3 different things come to mind. The first one is, you could always try submitting the information anonymously or plausible deniability. Just slip a piece of paper mail a piece of paper, right, with the information. You could try that. Another option is to try to get an agreement with the doctor or the MOA to say, don't tell them, and don't tell them. And then if they are upset about that, then let's say if a daughter is upset that the doctor's not telling her who gave up the information, then she can complain to the privacy commissioner's office. A lot of times when people are not sure, when GPs are not sure what to do, or even health authorities, they'll just say no, and then it comes to us. And that's actually a good thing for both sides, because we're the ones who are paid full time to try to work these things out. So if she could get an arrangement with the doctor where she just says, like, because the first question is like, okay, well, why? Is there something in the College of Physicians and Surgeons bylaw that is preventing you from doing that? And if there is, then we have a conflict of laws. So again, not to say we're the answer for everything, but I would suggest you call us and we can work through the conflict, because there's sections in PIPA and FIPA that deal with, like, if a bylaw of the College of Physicians and Surgeons says this, but PIPA says this. Because I mean, I don't know where that's coming from. I'm actually gonna have to take that away and find out why. I believe that physicians are saying this, but I don't understand why. So I need to do more research why. There's nothing in PIPA that is suggesting to me that with serious mental illness, they would need to reveal that information.
Okay, thank you. So maybe, thank you for that, Caitlin. So maybe next step in terms of that question, then perhaps my recommendation would be for that person to email you, or if people have other questions. Is that what your advice? Okay, so so for the person that wrote that question, please email Caitlin and our team to be able to get that information. And Caitlin, maybe it's something that we could even put on our website. So if there's, so you're not being bombarded with this question or people looking for the response, that we could even put perhaps on our website, so we can get that information out to as many people as possible.
That would be wonderful. And I mean, we can take it offline later, but I've certainly worked with organizations where they put out an FAQ, and it's not co-branded with our office, but our office is very pleased to review and comment on it. Absolutely.
Good. I like that. And unfortunately, we're running out of time. So Caitlin, this will be our last question, but please, if we did not, there's lots of questions here. If we did not get to your question, email Caitlin. And as we said, I know, Caitlin, that you will address all the questions. So last question for the day. Does the OIPC, so your office, Caitlin, have a mandate to assist in participating in the education of the various colleges / members? So examples, College of Nurses, College of Physicians, psychologists, social workers, regarding the education of their members, maybe even getting them to look at changing and adding to their own training curriculum about the members' discretion and various scenarios in regards to, for example, releasing client information to families. So that would be one question. The second question, has OIPC participated in ongoing CME credit training opportunities? Good questions.
Okay, thank you. Yes, we do have a mandate. You will not see the word education appear in the Act, but it's to basically get involved with anything to do with access and privacy. So outreach work. So absolutely, we're pleased to answer questions from colleges, and we're very pleased to speak at events, particularly in this virtual world where it's so convenient to do so. Now, forgive me, the CME credit, I'm not sure what that is. Is that College of...
That's a very good question.
Okay, I'm glad. So
yeah, no, you're not alone, Caitlin. I'm just trying to think of, people are working behind the scenes right now. They'll give me the answer.
Okay, wonderful, wonderful. So
we'll let you continue. So has OIPC participated in ongoing CME credit? We're going to figure out what that word is. Credit training opportunities.
Excellent. Well, we did put out, we did co-brand with the College of Physicians and Surgeons a handbook for doctors. So there is some information on our website about that. For now, I know obviously that's towards physicians, but it provides some good general information about the Act and how it works. And I'm wondering if it was CME, if it's continuing legal education, if it was CLE, but we have given talks about that.
I know now.
Okay.
Continuing medication education.
Oh, okay. Yes. Thank you.
We learn something new every day, Caitlin.
I was going to say it is a new term to me, but certainly we do speak at many professional events. That is a big part of our mandate and a big part of the work that I do. We also have a communications team, so I'm very pleased to speak at events. I know we speak to Law Society members, for example, for their continuing legal education, to doctors, to nurses. So I would imagine the answer to that is yes. For any of you on the call that are interested, if you go under the news tab on our website, there's a web form to request a speaker. And you just put in a little bit of information, and then within 2 weeks, you'll hear back about whether we can speak at your event or provide you with information. Also, for anyone on the phone, or pardon me, anyone on the call as well, frequently I find the most effective, you can email me, absolutely, or you can call our office and have an initial phone call with myself or one of my team, and then we will always give you an answer back in writing. Like if you need it, like, hey, I want this in writing for my own learning, or I want this in writing because I want to forward it to somebody else, we are absolutely happy to do that. So no problem to have an informal phone call first to kind of work through the nitty-gritty, and then we'll give you the sort of written reply, because that's often helpful for people.
That is really good information. So Caitlin, what is your phone number, just so we can write it down?
Absolutely. 250-387-5629 is our number. And then it's the info@oipc.bc.ca. My deputies told me I can't give out my own email address at big events because I would get swamped, but you will absolutely hear from someone from our office, and we've got a really great team.
Okay, thank you, Caitlin. Caitlin, I feel I'm looking at a whole bunch of other questions that we could ask you, but I'm just really happy that we were able to provide the scenarios from the family perspective, as well as that frontline clinician, because that's what we want. We want the families. Sorry, I'm looking at you, and I was just given the cue that I have to look into the camera. That we have the family scenarios, and we have the scenario from our clinician, because obviously we want our families and our clinicians finding ways to effectively work together. So I'm really happy we had those two scenarios, and then obviously had the opportunity to hear from you, our family members and clinicians, to be able to ask these very important questions. So Caitlin, and I really appreciated your transparency and for being so candid. So thank you for that. And I know that we are going to connect again. So as a reminder, if we didn't get to your question today, we are going to be working with Caitlin. You can contact her. You have her phone number. You have the email to her and her team. So please do not hesitate to reach out to get more information that you need to not only help yourself, but of course, help your loved one. So before you leave, I cannot believe how fast this event went. Before you leave, please take a few minutes to fill out the survey. It will pop up on your Zoom, and your comments will obviously help us improve any of our future events. And if you'd like to watch this again or share the information, you will be able to find a recording of this session and all the resources that were discussed today on our website, www.bcss.org. And I would like to take just a final, thank you again to Minister Malcolmson for speaking earlier, and as well as to our very generous sponsors, Janssen and Bell Let's Talk. Thank you for making this possible. And if you are not a member, please become one. As you heard earlier, there will be a members special event just for members. And really, it's just an opportunity to get information about BCSS, about our website, about our, any events that are happening. And we really do want to connect with you and hear from you. We want to hear your story. So please, if you're not a member, it's $15, become a member of BCSS. And I want to thank you, the team, again, for everything that you've done. I know it was one heck of a year, and I couldn't have done it without you, and we are in this together, and I hope you feel that. And I'm looking at you, team. And finally, to you, our members, our team, like I said, across the province, and our donors. Thank you for everything that you've done for BCSS. And thank you for being a part of our event today. We were a little hesitant about what this event would be like, just because it is legalese, but I'm so glad that we decided to go ahead and move forward with this event, because it's information that we need, and it's information and questions that we hear from our family members all the time. So I'm very grateful for the team for suggesting it and for us following through with this event. So thank you very much for being a part of today's session. Do not hesitate to reach out with any questions or comments, and we look forward to seeing you again. Thank you. Take care. Stay well. Talk to you soon.